Anaphylaxis doesn't wait. So you shouldn't either. And what I mean with that is it's a race against time. Every second when it comes in anaphylaxis counts.
Okay.
So that is something, if that's something you've been struggling with since you were
Yeah.
young and you're like, look, my life cannot be all about EpiPens and, auto injectors, you can maybe look into that because that is something that is currently available.
Anaphylactic reactions only happens with first-time exposures. And welcome to Consultation Room Podcast.
Okay. Welcome to another episode where we tackle one of the most critical and urgent topics in healthcare, and this is anaphylaxis. This is a severe reaction that can escalate within minutes. And as we know, anaphylaxis is life-threatening, but is often misunderstood. So what we're going to do today is we're going to talk about some of the things you need to know. So explore what anaphylaxis is, what triggers it, and how to recognize the signs and even symptoms before it becomes dangerous. Yeah. So whether you or your loved ones live with allergies, it's very important to be prepared. And this episode will equip you perfectly to give you all the essential information that you need for that. So, with no further ado, Steph, what is anaphylaxis?
Brilliant. So, as Trudy said earlier, anaphylaxis is a severe, potentially life-threatening allergic reaction that can develop rapidly after exposure to a trigger. The science behind this is that when the immune system overreacts to a substance, it releases chemicals like histamine, leading to widespread inflammation. So then this usually affects like the airway, blood vessels, and other organs that usually brings upon the symptoms. So the symptoms can usually range from like skin reactions to respiratory distress to cardiovascular issues and GI symptoms, because the inflammation literally affects all these organs and systems. So talking of symptoms, we're going to mention some few symptoms that you need to be aware of if someone or you yourself experience anaphylactic reactions. So I'll name a few. Trudy, you can join in if you need to.
Okay.
Yeah, so when it comes to anaphylaxis, the symptoms that you may experience may include hives, swelling, and itching. So hives on the skin, itching of the skin as well, and swelling can usually be swelling of your skin or your mouth or your tongue. So usually when the swelling occurs on your throat or your tongue, this can usually causes respiratory distress, so trouble breathing, and you may be wheezing. It may cause like throat tightness, so you may find it difficult to breathe, and it may be really fast as well. Sometimes you may even have trouble swallowing, and some people may get like cardiovascular issues such as like low blood pressure, or even feeling dizzy or faint. Some symptoms may also include feeling tired or confused, and there may be some GI symptoms as well, which includes like nausea, vomiting, and diarrhea. Trudy, do you have any other symptoms that you could think of?
I think you've mentioned most of them. I think the only one that maybe you haven't mentioned is what some people might notice is pale blue skin, but that would be indicative of not enough oxygen. So with, of course, difficulty in breathing, that could be one of the signs that, you are actually having an anaphylactic reaction. But you have mentioned most of them. I mean, the only other one also I would normally say to patients is because sometimes what happens with anaphylaxis is symptoms can can progress very, very quickly, and during this period, that's when you'll get the airway blockage, low blood pressure, but you could also get shock. So
Yeah.
shock is also one of the sort of escalating symptoms or signs of anaphylactic
Yeah.
reaction.
Brilliant, brilliant. And I did mention that when it comes to anaphylaxis reaction, is usually when the immune system reacts with like a substance. So there are triggers to it. Do you mind just going through the common triggers that people can encounter?
Yeah, of course. So most of it, I think the majority of people who have anaphylactic reaction would be from a reaction of some sort of food.
Mm-hmm.
And most cases, it's things like peanuts, shellfish, or even dairy.
Yeah.
So those three are very, very well known to cause anaphylactic reaction. So if someone has one of these three or any others as an allergy, it can be quite severe in some people that it can cause anaphylaxis.
Yes.
Another one is something like insect stings. So
Yes.
some people have anaphylactic reactions to any stings or specific stings. So some people may be like a wasp or like
Yes.
bees or
These.
things like
Yes.
that. They will have like anaphylactic reaction.
Mm.
And another one, which is also very common, is medication.
Yep.
And we know very well some antibiotics, like
Yep.
penicillin-based antibiotics, are known to cause anaphylactic reactions to some
Yes.
patients. And that's not to be confused for side effects, because
Yes.
we get a lot of this confusion where people come in and they say, oh no, I have a reaction to that.
Yeah.
But it's not really a reaction. You're probably having one of the side effects, which, as we always say, side effects are things that could potentially happen, not
Yes.
necessarily things that will happen. And if it's something that can potentially happen, it's something that is known to happen.
That's right.
But yeah, those are the major triggers when it comes to anaphylaxis.
Yes.
And I think it's worth mentioning something like, say, when it comes to foods, most people have or become intolerant to other foods because of an intolerance to one food. So
Yeah.
maybe they have, say, a peanut allergy,
Yeah.
or a nut allergy.
Yes.
Just to be precise. And then they will also have like maybe a shellfish allergy. So maybe they're
Yes.
just their system is just very sensitive, and they will almost not tolerate some things.
That's
But those
right.
are the main ones. I don't know if there's any stuff that you've come across that you want to add on.
Yeah, I think you've mentioned them, the main ones, which are the foods, insects, things, medications. The only thing I would add is like latex, anesthetics, and there are in some cases as well where it does occur without a clear trigger. So this is usually called like idiopathic anaphylaxis. So where anaphylaxis can literally occur, but we don't know what is triggering it. Yeah.
Yeah.
Yeah, so I would just add like latex and anesthetics to it. But one thing I will mention is that like having one allergic reaction doesn't mean you have anaphylaxis, but the
Yeah.
risk is higher. So although some people may be allergic to these medications, doesn't mean that like,
Yeah.
it will cause anaphylactic reactions. Yeah. Yeah.
That's good. I mean, I'm glad you've mentioned something when it comes
Yeah.
to some of these things. People take some things lightly, like when
Mm,
it comes to, say, latex, for instance. Some
mm,
people just say, oh, like, well, you've got latex allergy, like, what the
yeah.
heck, like, but they don't take it seriously as it is.
Mm.
Even let's be very frank here. It's consultation room podcast. Latex condoms, you know, if a girl tells you they've got a latex
Lit
allergy, don't be buying no latex condoms.
Yes, take it seriously
You
because you
better
don't
go and
know.
find those non-latex condoms, because you could just kill someone. Let's be very,
Yeah,
very frank here.
yes, that's
So
true.
some of these things is very, very important for people to take
Yeah.
seriously.
Mm-hmm. I totally
Yeah.
agree. Yes.
Well, we have mentioned, like we've talked about, like some people will have, say, one reaction and then they're prone
Mm.
to maybe another reaction. What are the risk factors? Is there like any groups, for instance, that
Yeah.
you would say are at risk of maybe having an anaphylactic reaction?
Yeah. Okay. Well, when it comes to anaphylactic reactions, I usually say anyone can have an anaphylactic reactions, but there are a group of people who are more prone to getting it. So
Yeah.
genetics obviously does play a fact. So if like you do come from like a family where they are
Yeah.
allergic to like a lot of like maybe food and stuff, it is likely that you may also have like anaphylaxis due to that, you know? And
Yeah.
if you do also have like history of allergies, let's say for instance you've been allergic to certain type of food, but you don't really get anaphylactic reactions from it. So maybe just exposing yourself to these allergens over time can lead to anaphylactic reactions. Yes, another group of people that I would say they are more prone to getting an anaphylactic reaction, I would say like asthmatics, because like already your body is like used to like these triggers causing a reaction, causing you to have an asthmatic attack. So these basically increases your risk of like getting anaphylaxis
Yeah.
reaction. Yeah. So these are the group of people I would say are more likely to get anaphylaxis. Yeah.
Yeah.
But yeah, do you have any to add?
No, I think you've mentioned them
Yeah.
perfectly. I mean, as you said, anyone can have anaphylaxis. So it
Yes.
could even be a very new thing
Mm-hmm.
where all your life you've been fine,
Yep.
you've eaten peanuts, and then all of a sudden you have a peanut allergy, and
Exactly.
you don't realize how bad the peanut allergy is, and maybe the next time you actually
Yeah.
ingest peanuts, you could have anaphylaxis. So literally
That's
anyone.
right.
There is no any specific group that is that is
Yes.
targeted. Anyone can have anaphylaxis. That is completely true.
Yes. Yes. That's
Yeah.
right.
Well, we did say sort of like risk factors or risk groups, but
Mm.
how would some of these risk groups, for instance, avoid anaphylaxis? So not necessarily even treatment, just avoiding
Avoid it.
anaphylaxis.
Yeah.
Yeah.
Okay. So by knowing what triggers your allergies or your anaphylactic reactions, that is a way of preventing you from getting one. So if it's
Yeah.
food that triggers you, avoid the food. If it is a medicine that is causing you to have this reaction, definitely do avoid it. So anything that really causes your allergic reaction, just make sure that you avoid it. So check food labels, carefully ask
Yes.
people, like, when you go to a restaurant, what is on the menu, and like what ingredients are in there. Don't think that you're being a pain. Make sure that you ask these questions because it will end up saving your life. Do
Yeah.
avoid like high risk situations. If you know, like, you're allergic to peanut and like your friends are going to, I don't know, they're going to bake with like peanuts and stuff. Don't get involved in it, Make sure that you stay
Yeah.
away from that. So in those situations, these things will like help you avoid getting anaphylactic reactions. Um Another thing is that to prevent you from having anaphylactic reactions, I think people need to be educated and make sure that you are educating the people around you, um, just to raise awareness that this is what causes my reaction. So please be
Yeah.
cautious, because sometimes some people might not know, oh, okay, you're allergic to something. One thing I would actually advise people is if you could carry like an ID bracelet just to say, okay, I get this, I get an anaphylactic reaction from this, so therefore I must
Yeah.
stay away. And it's even for
Yeah.
emergency sake, if you are in like any emergency situation, people would know, can easily identify that, okay, this is what you're allergic to, this is what we shouldn't administer, that sort of thing. So
Yeah.
wearing a medical ID bracelet, I would say it's my main thing. So to prevent you from basically getting anaphylactic reaction, I would say yes, manage your triggers
That's brilliant.
and educate people around you. Yeah.
You mentioned something, and I think it's very important, which is, that the whole wearing a bracelet. Some
Yes.
people actually, I saw this from an very old man. I think he's in his 80s or maybe even 90s. He
Mm.
came to the pharmacy, and in his wallet he had a list of all the medication he's on and anything he's allergic to, and it was
Oh,
laminated. And I thought that
wow.
is so clever. So
Yeah.
this is someone who takes their health seriously.
Very serious.
So that
Yeah.
even if maybe you don't want to wear a bracelet, maybe it's like, it's kind of like not going with your vibe,
Yeah.
like it's not going with your outfit. So you're like, I don't want to wear that bracelet. Maybe having something like this is very important. Just
Yes.
have a laminated, especially if you're on, say, a lot of medication as well. It's
Yeah.
very, very important to have a list of them, because when, say, there's ever an emergency, it's important for emergency services or anyone who will be administering any sort of like treatment to you to know what medication you're on. And if
Exactly.
you're unconscious, you're not in a position to tell them. So that is
Exactly.
actually a clever idea.
Yes.
But also, when you said that, I thought about something. Have you ever ordered food from Wagamama?
No, I haven't actually.
Oh, really? Okay.
No,
So when
no,
you
no.
go Wagamama, they
Yeah.
always ask you, have you got a seafood allergy? Sorry, have you got a food allergy? Sorry.
Yeah. I know
And then you
Busaba
say
usually
yes.
does. Yeah.
Yeah, yeah. And then they say, yeah, or whatever. You say you've got an
Mm.
allergy, and they say, okay, we'll get the manager. And then what the manager does is they come in and they basically, whatever you order, they make sure to have a look at, the ingredients of that
Mm.
food, how they're preparing it, just to
Mm.
make sure it doesn't have whatever allergen that you could be
Yeah.
allergic to. So with me, I have a seafood allergy, so they
Yep.
always sort of send for the manager, which takes longer. Everyone's food comes and mine is I'm still waiting for the manager. But
Yeah.
listen, if that is what causes me to not have any reactions, I will 100% wait for that
That's
manager.
it.
But I think most restaurants need to do that, where
Yeah.
maybe just ask people whilst making an order, is there anyone who has any food allergies or
Allergies. Yep.
intolerances? It's very important. And I know
Mm.
some like restaurants just think, oh, someone will remember to tell them if they have this. But
Yeah.
sometimes you get caught up. Let's say you're chatting with friends or whatever, and then you'll make you'll do your orders. You don't
Mm.
realize that you've not actually told them if you have an
Allergy or
allergic
not.
reaction, or
Yeah.
or anaphylactic reaction to some of these foods,
Yeah.
and that could actually be quite. Let's be honest, that can be quite fatal, especially
It's
if you're in a
true.
situation where you're not prepared.
It's
So I'm
true.
glad you really mentioned that
It's
point.
true, yeah. It's really important. Like, I don't think people should take it lightly. Say, oh,
Mm,
don't be, if you think you're being a nuisance, you're not being a nuisance. Literally, tell them you're allergic to this. Yeah. You tell them all of these things, it's better to be safe.
100%.
Yeah, yeah.
Yeah.
So we have gone through like the symptoms and stuff. So how would one go about recognizing and responding to anaphylaxis? Like, what should one do if they do encounter someone with anaphylaxis, like going through
Mhm.
anaphylaxis, or they themselves are having an anaphylactic reaction?
Okay, so one very important thing, and maybe this is part of avoidance strategy as well, is if you have, if you know you have anaphylactic reaction to certain things, always carry your auto injectors. That is the
Mm-hmm.
first, literally the first point. Like when you have an
Mm-hmm.
anaphylaxis reaction to any foods or anything, always have your auto injectors with you.
Mm-hmm.
We do normally give the epinephrine auto injectors, which is the EpiPen in the UK. They
Yeah.
used to be Jext, and I think Jext is no longer, is probably discontinued or something like that. But most patients who have anaphylactic reactions will have an EpiPen issued to them. So
Mm-hmm.
first thing would be, have your EpiPen with you all times, and if you suffer from an anaphylactic reaction, use the epinephrine auto-injector.
Yeah.
That's the first step. And after using this auto-injector, it's very, very important, and this is a step that shouldn't be missed. It's very, very important to call emergency services,
That's
even
right.
after you have used that EpiPen. Like,
Yes.
it's not just, yeah, I've used my EpiPen, now I'm good. No,
Mm.
just call emergency services, let them come and just do the checks, make sure
Yeah.
everything's okay. And whilst you're waiting for them, listen, don't get on about your day. Don't be now going back, into the garden. You're like, yeah,
Yeah.
let me prune these strawberries or whatever. I don't know.
Yeah.
No, it's very important to lie down with your
Mm-hmm.
leg raised,
Yes.
especially if you're struggling to breathe. That just helps with sort of like just breathing. So that is a very,
Yeah.
very important thing. And if, let's say, your anaphylaxis has been caused by, say, a sting, what you can do as well, you can remove this sting if they're still in the skin. Don't be going digging in the skin, but if you can see them, it is safe to just remove them as you're waiting for the emergency services. And what we always say as well is, if the symptoms don't improve after 5 minutes of using your EpiPen, you can always use the second auto-injector.
Second one.
Now, this is another very crucial point, which is you should not just have one auto-injector. You should have 2 auto-injectors. That is very, very important. And again, don't run, walk, start, standing, waving to, no. Listen, even if you feel better, you need to just sit down, or lie down, legs raised. It's very important to just keep that calm, because let's be honest, like what this allergen has done is it's kind of messed up your breathing system as well, and your circulation system. So you just need to sort of take it easy. And what could happen is sometimes, especially depending on how bad it is, you could go to hospital. And in hospital, you might get maybe some O2, some fluids. They will basically look after you there accordingly. So these are my very, very, these are my steps and they're very important steps to make sure that you are able to manage anaphylaxis. Now, when it comes to, say, the auto-injector, as we said, it's very important to have the 2. But more than anything, it's very, very important to know how to use the auto-injector. That is, I think, one of the most important, probably the most important thing when it comes to anaphylaxis. You could have it, you could carry around, but if you don't know how to use it, it's pointless.
Exactly. That's why we need to educate people on how to use it. You yourself, you need to learn how to use it, and also educate people around you on how to use it. But they do put the instructions on the side of the injector, anyways, for people that don't know. The instructions is usually on the side of the injector, but still get to know, practice. I think you can order a trainer one, right? Yeah, you can order a trainer one and literally like practice on how to inject and stuff. So that could save a life. Yeah, you could do that.
I think one also very important thing is to check the expiry. Checking the expiry of your auto-injector pen is very important, because it's not guaranteed that you'll actually use it within a year or within a couple of years. Some people are so good at sort of avoiding the triggers or avoiding whatever could be causing your anaphylactic reaction, that you don't actually need to use your EpiPen or your auto-injector. And then you go to Magaluf and you forget that you have a seafood allergy, and then you're numbing that paella. And before you know it, you need your auto-injector. But if it's expired, you're not even helping yourself. So it's very important, I think, to check expiry when it comes to the auto-injector.
Yes. Fantastic.
Have you ever used auto-injector? Have you ever had to show a patient how to use it?
Okay. Luckily enough, I thought you were gonna say, have I used it myself? Luckily enough,
have you used it yourself?
I haven't. But what we used to do is that, I've mainly worked in hospitals. So anytime we dispense an auto injector, we show patients how to use it, and we go through it with them. It's just so that even if they've had it before, we always go through it with them, just to make sure that you do know how to use it. Yes.
That is actually very important. And I don't know if it was at uni or if it was during my pre-reg or at some point during my years of being a pharmacist. There is this thing I heard about a guy who needed an EpiPen, right? And his wife was either the wife or the mother. One of those, but it's always a woman who's going to do the trainings, isn't it? She was shown how to use the auto-injector. But what they said to her is, just take off the top and just, onto the thigh. That's what they said. Take off the top onto the thigh straight. So I think one time she actually needed to use this auto-injector on I think if it was the son or the husband, whoever this person was. And she has been taught to take off the top and inject it on the thigh. And what she did is she took off the top and she injected it on her own thigh.
Oh, so dear.
So takeaway point here is, listen, you can do those trainings, but please make sure you know who you're supposed to use it on.
Use
I
on the
think that's why it's
person
very important.
suffering, please.
you know, and I think that's good, because the point you
Yeah.
mentioned, which is if they can get the trainer auto injector, because then
Yeah.
they can use it on them, on the person who actually needs
Yes.
to. Then they get into
Yeah.
the habit of, it's not my thigh, it's the other person's thigh.
Right. Oh dear, that is actually hilarious. That is hilarious. Like,
Can you imagine?
but I don't blame them. Sometimes we have to be literally like word for word and explain it properly to patient, because they can literally
Yes.
uh, do anything. People can
Anything.
interpret things like differently, so
Yes.
you have to explain things correctly. Yeah, but I
No,
don't blame them.
honestly.
Yeah.
Yeah, no, it is.
I don't
And
blame them.
it's a mistake very easily made, but it's
Yes,
also a mistake that can
exactly.
cost 2 lives.
Exactly. It's true.
Now,
It's
there's the
true.
person who doesn't have the auto injector, and there's
Yeah.
someone who needs emergency substance because they've injected themselves with the epinephrine.
Yeah,
So, yeah,
exactly.
definitely. Is there
Exactly.
any other strategies or any other treatments that you know of that can help with anaphylaxis besides the, say, auto injector, which people use for whenever they
Yeah.
have, say, a reaction?
Yeah. I mean, like the auto-injector is the main treatment for
Yeah.
anaphylaxis reaction. But I know some people usually keep like antihistamines for when they have like mild reactions. This
Mm.
necessarily does not take away like all the symptoms, but it's like if you're having like mild allergic reactions, they usually
Yeah.
help. But I wouldn't like, I would say yes, you could keep antihistamines with you, but if you are allergic and having anaphylactic reactions, the main thing to have is an auto injector. That is what is going to save you. Like, no,
Mm.
like, I don't think anyone has ever regretted like using an auto injector. So make sure you always carry that with you, as we said. Okay. Yeah. So
Yeah.
yeah, that is what I would say. Just an auto injector. Yeah.
Hmm.
Um,
I mean, now there is
Really.
therapies, isn't there, as well?
Again?
There's like desensitization therapies.
Oh, okay. Yeah, I've not heard of that.
Yes.
Hmm.
Yeah. So basically, because you know, an anaphylactic reaction is because you have sensitivity to something, whatever
Mm-hmm.
allergen is. But now there is desensitization therapy
Okay.
or treatments that are
Mm.
supposed to reduce allergy sensitivity over
Yeah.
time. So
Okay.
that is something, if that's something you've been struggling with since you were
Yeah.
young and you're like, look, my life cannot be all about EpiPens and,
Yeah.
auto injectors, you can maybe look into that, because that is something that is
Mm.
currently available for patients who have anaphylactic reactions to things.
Yes. Yes.
Yeah.
Yes.
And there's also
Brilliant.
allergy testing, isn't there?
Yeah.
So,
Yeah. We always say if you're allergic to something or if you don't know what you're allergic to, it's better to go for an allergy test to see what is out there, what is causing your reactions, and just to avoid it. Yeah.
mm, yeah, exactly. I think that
Brilliant.
is quite important, just to get that, you know, that check, just to make sure there's nothing that is
Yeah.
causing any reactions or anything. And that's very, very important.
Yes, yes, yes. Brilliant. Is there anything else to add? Otherwise, I would say we should go to the myths and bust some myths.
Okay, no, let's go to myths. I think we have
Yes.
discussed everything in regards to what people need to know,
Yes.
what anaphylaxis is, triggers, and all of that. Let's go
Yeah.
to myths. I love this bit.
Yeah. I mean, I don't really have a lot. I've only got a couple.
Mm-hmm.
But it's good to just go through it just to debunk them anyways.
Yeah.
The first one I have, I'm sure we've already touched on it. It says anaphylactic reactions only happens with first time exposures. And
Mm.
what I would say with that is that reactions can occur after repeated exposure. So
Yeah.
if like just because like if you do encounter something the first time, it doesn't necessarily mean that you will get a reaction then. Sometimes it builds up. So
Mm.
yes, like there's some people they might be like, oh, I've been exposed to peanut before, but I didn't get any reaction. But then later on in life, they do end up
Mhm.
getting like anaphylactic reactions, sometimes it does build up. So that's one thing I would
That's
say. Yeah,
true.
that's not true. First time exposure does not always, occur with
Yeah.
anaphylactic reactions. Yeah. Do you have any myth?
Well, I can think of a few only because it's
Okay.
things I've heard, and unfortunately, I have friends who have anaphylactic reactions, and they always ask me this, so
Mm,
I can think of a few. But the only thing I've been asked is if I don't have an EpiPen, is an antihistamine going to be enough? Like if I take
mm,
antihistamines, is
yes.
that going to be enough to just sort out
Yeah.
my anaphylactic reaction?
Mm,
Which the answer to that is no.
no.
It's not going to be. It's good because it's going to help with some of the symptoms, but it's
Yes.
not enough. It's not
Yes.
enough because an anaphylactic reaction definitely
It's
needs more.
severe.
I
Yeah.
mean, it will help, as we said, with sort of the symptoms like sort of the skin rash and maybe if there's
Mm,
any itching or anything like that.
mm,
But and these are mild sort of symptoms, but for the the major symptoms, which can sort of be escalating symptoms, the antihistamines are not going to touch it.
yep. So yep, you're right about the antihistamine not being enough for anaphylactic reactions. Um, so my other myth that I've got is that epinephrine is dangerous. What I
Mm-mm.
would what I would say with this is that it is safe and life-saving when used as prescribed. But if you're using it
Yeah,
incorrectly, yes, that's when it's dangerous. But you have to use it as
yeah,
prescribed. Yes.
that is
Do,
correct.
yeah. Do you have any other myth?
I think the only other one I can think of is just to do with sort of the auto-injector, which is the epinephrine
Yeah.
again. Where
Mm,
people think that epinephrine is going to fix everything. So if you have
yes.
an anaphylactic reaction, if you have your epinephrine and inject yourself with your epinephrine, that's going to fix everything, which
Mm,
to some extent is a myth because it's not going to
mm,
fix everything. Because if, say, you have a severe reaction, you might need multiple doses or you might even need
yeah.
further treatment. So that is not going to fix everything. So that is also
Yeah.
another myth that people have when it comes to anaphylaxis.
Brilliant. Brilliant. Brilliant.
Yeah.
Yeah.
Well, I guess we've come to the end of our episode on anaphylaxis. But as
Mm-hmm.
usual, we always do a takeaway. So,
Yes.
Steph, what is your takeaway in regards to anaphylaxis?
Yeah. So, anaphylaxis is a medical emergency, and time is really critical when it comes to this. And epinephrine saves lives. So, make sure you know the signs and you're being prepared. And these things can make all the difference. So, once you know how to recognize the signs and symptoms of anaphylaxis, this can literally save life. You be able to easily recognize that someone is having a reaction, and make sure you carry your epinephrine at all times. And as we always say, carry two with you because you never know when you need the second one. Most
That's it.
importantly, as well, I would say talk to your doctor if you suspect you're at risk. It's just so that they would make their investigations just to make sure that you are allergic or do have an anaphylactic reactions to certain things. So, Trudy, what is your take on message?
That is good. What you've just said is perfect. Honestly,
Yeah.
people need to share this episode, especially if you know anyone who suffers from
Yes.
anaphylaxis, anyone who might be interested in knowing more about anaphylaxis. Share this episode with them.
Mm-hmm.
It might just save a life.
Yes.
So my take-home message when it comes to anaphylaxis is anaphylaxis doesn't wait. So you shouldn't either. And what I
Mm.
mean with that is it's a race against time. Every second when it comes to anaphylaxis counts. So it's very important to
Yes.
recognize the symptoms, even if it's not just for yourself, to know the symptoms of anaphylaxis, to recognize them in others, and act immediately. That is very, very important.
Mm.
Now, life with severe allergies isn't just about avoiding triggers because people are like, if I avoid triggers, I'm good. It's not just
Mm.
about that. It's also about being prepared. And as you said, Stephanie, having that EpiPen, having 2 auto-injectors is very, very important. That's preparation.
Yes.
And when it comes to anaphylaxis as well, action is everything. So it could, let's be honest, it could mean, it could be the difference between life or death. So
Yes.
if you have anaphylactic reaction, or if you know someone who suffers from allergies and they could have an anaphylactic reaction, it's very important to act fast whenever there's an anaphylactic reaction that's happening. But otherwise, I think we have geared people with enough knowledge.
That's
So
right.
yeah, I'm quite happy. I feel like we've shared something good today, actually.
Yes. Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.